For tonight's B, guys, we're going to look at holistic end of life care. Okay. I made a little presentation for you, so please join me for presentation B, holistic end of life care. Okay. Here we go. Holistic end of life care means weaving physical, emotional, social, and spiritual support into the entire care journey. Not treating dying as a separate phase. It emphasizes dignity, personalization, and community involvement. Core principles of holistic end of life care. Whole person focus. Care addresses body, mind, spirit, and relationships, not just medical symptoms. Personalized dignity. Plans respect cultural, spiritual, and individual values, ensuring patients feel seen and honored. Family and community integration. Families, caregivers, and communities are active participants, reducing isolation and empowering shared decision making. Interprofessional collaboration. Nurses, physicians, social workers, chaplains, and therapists coordinate to provide seamless, compassionate supports. See, guys, holistic care teams work together to support the person that is passing and to honor their wishes. Okay, key components of holistic end of life care. Physical care, pain and symptom management, comfort measures, and appropriate use of technology. Emotional care, counseling, grief, support, and stress management for patients and families. Spiritual care, space for meaning making rituals, faith-based practices that align with patient identity. Social care, strengthening family bonds. Community ties, caregiver support networks. Give me 1 second, please. Alternative therapies for holistic end of life care. Music, art, massage, and mindfulness practices to enhance comfort and reduce anxiety. Okay. Practical integration strategies. Normalize early conversations. Treat end of life planning as part of ongoing care, not a crisis only topic. advance directives and documentation, ensure wishes are recorded and accessible across care settings. Community-based programs partner with local organizations to provide culturally responsive support. Technology use, telehealth, symptom tracking apps, and supportive devices can extend comfort and autonomy. Okay, evaluation and feedback loops. Regularly assess outcomes using tools like nursing outcomes classification or NOC to refine care. Benefits of holistic integration. Enhanced quality of life. Patients experience comfort and meaning in their final chapter. Reduced family stress, clearer communication, and shared rituals ease caregiver burden. Equity in care, respecting cultural differences, prevents one-size-fits-all approaches and promotes inclusivity. Continuity across settings, from home to hospice to hospital care, remains consistent and values driven. Integrating end of life holistically is about living fully until the end. It reframes from dying as a human experience that deserves the same compassion, personalization, and dignity as any other stage of life. By embedding physical, emotional, spiritual, and social dimensions into care. We create a model that honors both patients and families and strengthens communities in the process. Giving your focus on participatory design and culturally responsive frameworks. Would you like me to sketch out a community-based toolkit that shows how local organizations, caregivers, and clinicians can co-create holistic end-of-life pathway? Okay, guys, so that is your B for now. So, with that being said, I'll be back on with C shortly. Give me a bit to put that together for you, and I'll be back on with that as soon as I can. Thanks a lot for watching. Be back on with C shortly. For now, Gator Wellness. Take care, folks.